There's a large chance that you or someone you know has some sort of disability. The number of Americans who have them is on the rise. The number of people with disabilities is growing because of diseases and an aging population. 1 in 4 people now have a disability. Now, a federal funding cut puts a program aimed at supporting people with disabilities in jeopardy. Here to help explain this, Dr. Amy Hewitt, the director of the University of Minnesota's Institute on Community Integration, and you are a professor in educational psychology. I'm really excited to talk to you about this issue and get some clarity on this. I know you guys were quoted recently in the Duluth Tribune raising concerns about federal budget cuts. We keep talking about those. What are you really looking at for people with disabilities?
It's a really interesting time that we're living in, and at the University of Minnesota, I direct an institute that really works to train professionals who support people with disabilities. We do research on groundbreaking issues related specifically to people with developmental disabilities. And our programs really are at high risk. The recent legislation that was passed, the Big Beautiful Bill, had us targeted for elimination, the funding that supports much of our work. And we had some good news this last week with the Senate Appropriations Bill. The system's complicated to watch, right? You think a bill passes and it's done. We still have time to make some important change. But with the loss of funding, we would no longer be able to train a lot of the people that we have trained at the Institute on Community Integration are leaders in services and supports for people with intellectual disabilities, and those programs would stop.
And they would stop, right. So give people some examples of the specific type of supports that you're providing people with, life-changing supports.
Sure, I'm happy to. We don't directly support an individual. We change the system and we change the policies, and we try out new things. So for example, one of our programs is reaching out to individuals and families in greater Minnesota using tele-outreach strategies to help people and families get off waiting lists earlier and get the supports and early intervention that they need.
And there's so much paperwork in this world.
There's a lot of paperwork, but luckily we don't necessarily do a lot of paperwork to support people. That's one of the strengths of being able to demonstrate new things is our funding lets us try new things before they become regulated and become complicated. We try to make things more efficient and easier access for people with disabilities.
Which is a big, big deal. And I know we have a lot of viewers out there who want to support the community and are probably troubled hearing what you're saying, that this could impact people's lives negatively. If people do want to help support the center, what can they do right now?
I think the most important thing that we can do is exercise our right to hold elected officials accountable to what our communities need. And so reaching out to, particularly at this moment in time, the representatives that support you in Washington, D.C., and the next step in our fight to keep funding and keep services, Medicaid, all of it, is to connect with our House of Representatives folks and let them know what we want. And what we want is that people with disabilities have the right to live in the community, need to live in the community, and thus we need support to make that happen. And right now, most of that funding is on the chopping block. It will affect people negatively, despite what we're hearing out of Washington, D.C. from so many people who say it won't affect them, but it will. There's no way you can cut Medicaid to the extent that is proposed without it cutting services for people with intellectual and developmental and lots of other disabilities in our state.
Okay, well, thank you again. And then mention the center. I know you guys have a new website, you have a Facebook page.
Yeah, please visit ici.umn.edu and you can learn all about our programs. We support individuals and families from birth to death. We're life course, and we're multidisciplinary, meaning that we work with people in all professions to support people and families.
Well, thank you so much for
Thanks
what you
for having
do
me.
and explaining this to us. Thank you, Amy.